Vostek sign. Vostek and Trozas, two sign. You have to remember these two sign. Why? Sometime they will give you this question that this sign is positive. What is the diagnosis? Okay. So these are the two tests, Vostek and Trozas sign. Okay. Now from this table, you have to understand that what are the causes of hypocalcemia in infancy. This question is very popular in AKP and also part 1. Most common cause is maternal deficiency, maternal vitamin D deficiency. This is the most common cause because from mother we are getting this. So hypoparathyroid, aplasia or hypoplasia of the parathyroid gland. Okay, and DGeorge syndrome. This is another cause of hypoparathyroidism because they have midline defect. Bacterial deficiency, and give Chart syndrome. Okay, Chart syndrome. Cannot excrete excess potassium, excess phosphate. So there is deposition of phosphate into the body. That time the calcium will be low. So there will be tetany. Because the main muscle action, main nerve action is done by the calcium, not phosphate. So liver disease, vitamin D deficiency, resistant, excessive phosphate intake from the food, cow's milk food or other food, excessive phosphate in drugs, some drug, parenteral nutrition, and renal failure. Okay. Okay, so okay, this question we finished, nutrition chapter. Any question from this calcium deficiency? Okay, there is another part of this question. Okay, this part is called other causes of hypocalcemia. Other causes is malabsorption syndrome, like Crohn's disease, cystic fibrosis, then ulcerative colitis, celiac disease. They can also have hypocalcemia. Alkalosis. Now, this question is very important. What is the relation of alkalosis? Respiratory alkalosis is caused by hyperventilation. Suppose you are doing hyperventilation. What will happen? Carbon dioxide will wash out. So there will be respiratory alkalosis. Okay. And this respiratory alkalosis, metabolic alkalosis occur with the administration of bicarbonate, diuretic, or chelating agent such as high dose of citrate taken in during massive blood transfusion. These are the causes of hypocalcemia. So remember, there is a relation of alkalosis with hypocalcemia. Pancreatitis can cause hypocalcemia. Why? Because in the pancreatitis, there is some loss, intestinal loss of calcium, because calcium bind with some hormones, they absorb, okay? And in pancreatitis, this calcium cannot absorb from the gut. Hungry bone syndrome, that means rapid skeletal deposition. This is seen in infant. This question came in exam one time. The infant, nothing problem, but he has high alkaline phosphatase. This alkaline phosphatase high, why? Because of the rapid bony turnover. Okay, rapid skeletal mineral deposition is seen in infant with ricket or hypoparathyroidism after starting vitamin D therapy. This is called rapid bony turnover, hungry bone syndrome. In infant, it is hungry, bone is hungry. In hypoparathyroid, bone is hungry. That time you can get hypocalcemia because all the calcium will deposit into the bone. Bone will be hungry. Okay, so this is the features for, okay. Any question now? Okay, let us move to the next case. Next case is nutrition, chapter number 15. Okay, open your book, chapter number 15. Chapter number 15. Achha, give me 2 minutes, just 2 minutes, okay? I have something to give for Tahir growth chart. Okay, you can listen that. It will be helpful for you. Even in clinical, they will give you growth chart. Okay. So this boy is a 10-year-old who had been previously well, present with tiredness and lethargy. For the last 6 months, clinical examination shows no pallor, clubbing, or lymphadenopathy, and systemic examination is unremarkable. He weighs 70 kg. See, 10 years, 70 kg, very high, and has a high height, 140 centimeter. BMI 35, very high BMI. So see, if you can see the growth chart in your book, okay, the child has rapid growth in 9 years of age. Rapid growth in 8, started from 8. Can you see the lower rapid weight? Lower one is weight, upper one is height. Okay, the lower one chart is, suppose this is the like your book. This is the upper one. Okay, this is the upper one and this is the lower one. Here, lower one from the 8 years, you see the child is gaining weight so much. But the height was okay. Height was not so much. So this part of growth from the 8 year, this much growth, 8, 9, 10, this is not normal. And this is not puberty. In puberty, why the child will be more weight? He can have height, but he will not have more weight. So the weight you can see in your book, weight is very, very high going upward. But height is okay. Okay, height is okay. It is also high. That is called nutritional obesity. Height is also high, weight is also high. It is not pubertal growth spurt. Can you say why? Pubertal growth start in a boy does not start from 8 years. See, the child is 8 years when he has more than 90th centile weight. So this 8 year, at the 8 year, the child will not have more than 90th centile. It is not possible. Okay, so this child is not nutritional growth spurt. In nutritional growth spurt, he will not have so much obese. Okay, so this is called, sorry, what I am saying, in pubertal growth spurt, he will not have so much obese. So this child is having high weight and height. So this is called nutritional obesity. Now you can ask me why the child is tired and lethargy. Tired and lethargy feels like he is hypothyroid, but actually he is not, because if any child is going obese, he will have lethargy. He will have tiredness, lethargy. Okay, this is association. This is not like the child has any disease. He is obese. He maybe have bullying in the school. He may have feel lethargy, tiredness. What is the most important investigation at this stage? MRI, we will not do. Echo, we will not do. Lipid profile, yes, it is important. Thyroid function, yes, it is important. But the most important is to check diabetes mellitus. Here in this 5 option, I will check glycosylated hemoglobin, because the child can develop type 2 diabetes mellitus. Okay, in this option, there is no random blood sugar. If there is random blood sugar, I will choose random blood sugar. You got my point? Because type 2 diabetes mellitus is mainly related with obesity. Hypothyroid, lipid profile, yes, they are the second line, but the primary investigation is diabetes. Because the child is tired, lethargy, he can have shuttle